So we're leaving Australia now. We're going on a jet plane. We're coming to Europe, and our next speaker is from Hungary and is going to present his talk on double CLs and the CLs and then diagnosing twin pregnancy and the accuracy of those. The floor is yours.
Thank you. Dear Ms. Chairman and dear colleagues, my name is Zoltán Szelényi. I'm coming from Hungary, and I would like to speak about a part of my PhD work, which is carried out with the help of Professor Szent from the Hungarian faculty, but this work was also in a collaboration with the Liège University with Professor Jean-François Beckers. And I would like to talk about twin pregnancy diagnosis in dairy cattle. So now we're shifting for a moment from beef to dairy, but please forgive me this. In the life of the modern dairy cattle, the first reports about the increased ratio for twin pregnancy or twin gestation came out 15 years before. Since then, we know that we have to take care about this problem because of the economical losses that effect of twin pregnancy causes. During this time frame, pregnancy diagnosis has developed all over the world. The early pregnancy diagnosis is available. And not only available, we already have experience, decades experience with early pregnancy diagnosis and problems around this. Our aim in this study was to measure in singleton and twin carrier animals the progesterone and the bovine pregnancy associated glycoprotein levels, and we were trying to set up a clinically useful threshold to disseminate twin and singleton pregnant animals with practical relevance. A few words about these pregnancy associated glycoproteins. Everybody knows the basis that they are produced by the binucleate cells or sometimes trinucleate cells. From the early studies, we know that they are able to monitor pregnancy, to predict pregnancy losses, predict stillbirth or abortion, or even placental anomalies. This graph was carried out by the Spanish group, Professor Lopez Gatius, in 2006 or 2007. Since then, they are intensively taking care about twin pregnancy, and they are reporting as high percentage of twin pregnancy as 15 or 20% at the time of the early pregnancy determination, so around day 30. But they suggested that with this graph that there is a scissor between singleton and twin carriers in the pregnancy protein concentrations. So the number of fetuses is affecting the concentration of the pregnancy proteins. Therefore, the question comes if we can disseminate only based on pregnancy proteins. Second thing is the progesterone concentration. Many studies coming from Wisconsin are suggesting that 2 corpus luteum, or all over the world now, the 2 corpus luteum produces more progesterone than 1 corpus luteum. However, there are some contributing studies which, wrong button. There are some contributing studies which suggest that the day of cycle also influences the progesterone concentration, but I would like to keep in mind that 2 corpus luteum in some studies producing only with half or 1 nanogram more progesterone, which is enough to decrease pregnancy loss, is enough to maintain a pregnancy. But the question comes, is it enough to disseminate 2 CL barriers from 1 CL barriers? Therefore, we were setting in a study with 84 Holstein Friesian cows, which were entering to the study at the moment of the early pregnancy examination. That was the first sampling time, after that, 3 additional sampling time points we had: the first, the second, the third, and the fourth month of pregnancy. This way we have monitored the first trimester of gestation, not only by means of ultrasonography, when we were looking for the heartbeat and the embryo presence and the CL, which was at least 2 centimeters in the biggest diameter in the 2-dimensional picture, but we have sampled from the coccygeal vein blood samples from the animals, and from these blood samples we have measured the progesterone and the pregnancy-associated glycoprotein concentrations by radioimmunoassay. That was the method of choice. About the settings of the measured data, the grouping of the animals were done to 3 groups. First group was the twin pregnant group. There was a group with a singleton pregnant but with additional corpus luteum group, and there was a control group with 1 corpus luteum and 1 embryo. I forgot to mention that the animals in all groups have calved. We have followed them until calving, and the animals have calved according to these groupings. So if we found 2 embryos at the beginning, then 2 born, every other animal was excluded from the, from the study. These data were going into the general linear model for analysis. Then a trick, so-called trick, came. We have to evaluate the clinical usefulness of the data. We have redistributed the groups in terms of P4, animals with 2 CL versus 1 CL were evaluated, and in terms of pregnancy proteins, 2 embryo versus 1 embryo were evaluated. Let's see the results. This is the general linear model where in terms of pregnancy proteins, every time point and every group, there was significant difference between every time point and every group. In terms of progesterone analysis, there was significant difference only within groups. This is the histogram of the data. These are the P4 concentrations in the sampling month between the 1 and 2 CL carrying animals. These are not meaning significant differences. These are outliners only. As you see from the P4 results, from the 3rd and the 4th months of pregnancy, it seems that we can set up, based on the box plots, clinical cutoff levels. If evaluating again the concentrations of progesterone at time point 2, so at the 2nd month of pregnancy, we found significant P, and every time point, so all month of pregnancy, the pregnancy proteins were found to be were differing significantly. Therefore, in the linear regression, we have selected, based on the data, cutoff levels with the aim of the statistical program, and we have evaluated these cutoff values for sensitivity, specificity, and area under the curve. And as you see, pregnancy proteins, and even as progesterone in the 2nd time point, pregnancy protein concentrations, the selected cutoff is not enoughly sensitive in any time point. However, the specificity is sufficient amount, and the area under the curve values were below above 0.8 only at the 3rd or the 4th months of pregnancy. What consequences are coming from this? Regarding the progesterone, in this study we were not able to differentiate 1 and 2 CL carrying animals based on the progesterone concentration in the peripheral blood. Surely there must be influencing factors for progesterone concentrations. We did not evaluate milk yield, However, all these samples were taken in not heat stress, non-heat stress period, but heat stress must have an effect. So many influencing factors are not helping us to determine progesterone concentration for pregnancy diagnosis. Meanwhile, in cases of pregnancy-associated glycoproteins, we could set up clinically clinically available threshold above day 85, 84, 5. So from the third month of pregnancy. The conclusion from this is that in the early stage, when we have to identify, because of management factors, the twin pregnancy as soon as possible, still the ultrasonography seems to be the most, or sometimes the rectal palpation seems to me the most applicable method. These results can lead to a further way of, further road of studies. Hopefully we'll go on this road. Thank you very much.
Thank you very much. Any questions from the audience? Someone's getting up, yes.
Good morning, Jay Romano from Texas, USA. I would like to know, when you mention twin pregnancies can be bihorn or unicorn. Yeah. I would like if you elaborate your
But in this study we did not evaluate because as far as I know, in unicorn and bicorn twin pregnancies, the pregnancy-associated glycoproteins are not differing, or yes?
Factor, as you know, the pregnant-associated glycoproteins are produced by the giant cells of the trophoblasts, and the number of placentomes in bihorn is significantly higher in unicorn twin pregnancies.
Yeah, this was not evaluated in the study.
Any other questions? Can I ask? You had single embryos with 2 CLs. Have you any idea, were they double ovulations with 1 fertilized, or did you have embryo loss? Were they cows with embryo loss? Because you had a higher N in that group. Can you speculate how many of those were twins originally, maybe?
That's a good question. And in this study, so I tried to select in those animals where ultrasonographic signs of embryonic mortality, which is the highest around day 30, 35, in cases of twins, were not visible. So for singleton ones, or especially for double corpus luteum ones, I was trying to set in those kind of animals. However, there's a risk, yeah. So that was maybe if we would measure 1 week earlier a pregnancy protein level, that could be helpful, but the animals were entering at the time of the early pregnancy diagnosis. Yeah.
No other questions? Thank you very much.
Thank you.